We want to say good morning this morning, right now, in fact, to the Infection Prevention and Control Coordinator from Maui Health. I want to say good morning to Carl Duman. Carl, good morning.
Hi, good morning, Shane.
You know, Carl, the subject we've been hearing as of late on the news, measles. Let's talk about that a little bit, Carl.
Sure.
What is measles? And is it very contagious like COVID?
Yeah, measles is a super contagious virus that spreads through the air, like when someone coughs, sneezes, or even just talks. And while many people are vaccinated against measles, people who are not vaccinated should be concerned. That's because the measles virus can stay in the air for up to 2 hours after an infected person leaves the room. And if you're not vaccinated and you're in that same space, there's a high chance you'll catch it. Even if you don't even have to touch anything. It's just breathing in the same air can be enough. It usually starts with a fever up to 105 degrees and at least one of the 3 C's, which is cough, coryza, which is a runny or a stuffy nose, and then conjunctivitis, which is irritated and watery eyes, and then a rash. And the tricky part is people can spread it before they even know they're sick, and that's why outbreaks happen so fast, especially in places with low vaccination rates. So we're urging our community to get vaccinated. And if you're a parent and your child skipped their MMR vaccines, please strongly consider getting them done now.
You know, our concern always for our keiki first. How serious is measles, especially for our kids?
You know, measles isn't just about a rash and a fever. It can lead to some pretty serious stuff like pneumonia or even swelling of the brain. Kids who are under 5 are at most risk, and some end up in the hospital. And it can even lead to long-term problems like hearing loss, and in rare cases can be deadly, which is why health officials take it so seriously. Babies who are too young to get vaccinated are especially vulnerable. And some of our schools on Maui have vaccination rates below 75%, which means more kids are at risk. And it only takes one case to trigger a bigger outbreak if enough people aren't protected.
Carl, how effective is the MMR vaccine, and why should someone care if they're already vaccinated?
You know, the MMR vaccine is about 97% effective with 2 doses, and that's some pretty solid protection. If you've had both doses, you're likely covered for life, so there is no need to worry. But it's not just about us. Getting vaccinated helps protect babies and the folks who can't get the vaccine. So community protection matters, and we all need to help keep each other safe. If you're not sure if you've had both doses, you can check with your doctor or get another dose just to be safe. The vaccine is safe, and the side effects are usually pretty mild, maybe a sore arm and a low fever. And with measles cases popping up again, it's a good time to double check your status.
Awesome. Carl, thank you for calling us this morning. Some great information, and we'll talk again. All right, buddy?
You're very welcome. Thanks so much.
Awesome.
All right. Bye.
Carl Duman from Maui Health this morning.